A tumor that doesn't actually have any blood vessels cannot grow any bigger than the head of a ballpoint pen. But the moment blood vessels can touch that little tiny microscopic tumor and start to feed it, a cancer will grow 16,000 times in 2 weeks. And studies have shown just eating even one overnight will start to change your gut microbiome, favoring more healthy species of bacteria. Cancer cells avidly use glucose to fuel their own metabolism. Our bodies are able to take any glucose and take it down to a sub-threshold that wouldn't drive that cancer cell any faster than it would a normal cell. If you got diabetes, it's a different situation. And so if you wanted to be safer, you might want to stay away from.
Some cancer patients are told, eat whatever you want. It won't change anything. That isn't the whole story. If damaged DNA keeps getting hit, and tiny blood vessels keep feeding hidden cancer cells, tumors can grow, spread, and come back stronger.
Now, cancers are forming all the time. So right here, right now, my body and yours and everybody watching this podcast, we're forming little microscopic cancers in our body right now. Why? Because we got 40 some trillion cells that are dividing, making more cells all the time. You make one or two mistakes in those cells, bingo, you got a tiny little microscopic cancer, like a pimple. And like a pimple, it's harmless because it doesn't have a blood supply. So then your immune system wings by, finds it, and cleans it right out. It's like, or your immune system's like a cop on a beat, okay? And it'll take it right out, take the bad guy right out. However, cancers can become dangerous when they are able to hijack our angiogenesis system. So this is really part of the nefarious, dirty deeds of cancer. They can be harmless and sit in the background in our bodies all the time, anytime. But if they find a way to leak proteins called growth factors that act like fertilizer, and they hijack our lawn, that turf that we're trying to grow, and they grow blood vessels into themselves. And I've done research on this. A tumor that doesn't actually have any blood vessels cannot grow any bigger than the head of a ballpoint pen, the little ballpoint thing. That's it. And it can't get any bigger. It doesn't have enough oxygen, no nutrients. So it's stuck. But the moment blood vessels can touch that little tiny microscopic tumor and start to feed it, a cancer that is the size of the tip of a ballpoint pen will grow 16,000 times in 2 weeks. So this is an explosive trigger when angiogenesis is hijacked and our body isn't able to control it. So that's called tumor angiogenesis. And that's how I got started in this field, because we were at the beginning trying to set out to figure out, how do you develop biotech drugs that can starve a cancer by cutting off its blood supply? Well, we've done that. And it's actually one of the mainstays of cancer treatment today.
Food is not a cure, but it can support your body's own defenses. Simple snacks can help protect DNA, support repair, and make the body less friendly to cancer growth. Most people don't get cancer from one bad meal. Trouble builds over time. Tiny hits to DNA and steady low-grade inflammation year after year. Some snacks make that worse. Ultra-processed choices loaded with added sugar, trans fats, or chemical additives can drive inflammation and may raise risk for several cancers. Other snacks do the opposite. Fruits, vegetables, whole soy, tea, and colorful plant foods bring polyphenols, vitamins, and fiber that help protect DNA, calm inflammation, and sometimes slow the growth of new blood vessels that tumors need to spread. Big studies back this up. In 2023, researchers from Harvard School of Public Health pooled data on more than 2.2 million people. Those who ate healthy, plant-rich diets had about a 14% lower overall cancer risk than those who ate the least healthy diets. That study did not say apples or green tea cure cancer. It did show that eating patterns matter and supports Dr. Lee's idea that plant-rich foods help your body's defense systems. Here's your quick preview before we dive in. One of the 5 snacks you'll hear about has been shown in lab studies to protect DNA from free radical damage. Another helped men with prostate cancer slow the rise of their PSA marker in a human trial. Now, let's go snack by snack so you can start using these ideas today. Snack number 1. Apples and apple cider vinegar.
So here's what we know about cancer. We know that we no longer talk about cancer just in terms of the organ it's in. The modern conversation about cancer in the medical community isn't it's a colon cancer, so it's a colon disease, and it's a brain cancer, it's a brain disease, it's a breast cancer, it's a breast disease. We're actually talking about at the microscopic level that cancer has a microenvironment. It lives in a microenvironment. So just like if you had fish in a fish tank, what's going on around the fish in your tank actually makes a big difference in terms of how well the fish actually thrives. And so cancer, think about cancer being like in an aquarium, and that aquarium being kind of miniaturized in our body. There's a microenvironment. There's a little mini terrarium or aquarium around every tumor, every cancer cell. And so among the most sophisticated cancer researchers, and I count myself in that group, we now refer to cancer as very much due to related to cancer cells and the microenvironment. And where sugar comes in, along with other micronutrients in the microenvironment that feed both normal and healthy cells, is the fact that glucose is uptaken by every single cell in the body. But because cancer cells are revved up, they are able to actually take that nutrient and actually fuel themselves. So what started as sort of like a well-intentioned interpretation by a non-medical profession has now been really validated, I think, by the cancer research world. Now, because sugar itself sort of quickly goes to stuff you would add to your drinks or your desserts, it all of a sudden becomes kind of a flip topic. But in reality, I think that it's incontrovertible that to cancer researchers that cancer cells avidly use glucose to fuel their own metabolism. So here's where things get more sophisticated. In a typical person, let's say you or I, or someone watching this podcast who doesn't have diabetes, our bodies are able to take any glucose that we introduce by our diet and take it down to a sub-threshold that wouldn't drive that cancer cell any faster than it would a normal cell. So in other words, our endocrine system, our body's own ability to process glucose pretty much takes anything that we introduce in our stomach, and although there might be a quick spike, we'll take it back down within a few minutes. If you've got diabetes, it's a different situation because your hyperglycemic microenvironment that your whole body represents is probably contributing to the growth of that cancer to begin with. And so if you wanted to be safer, if you had cancer, you're struggling with cancer, and even if your body's ability to process sugar is fine, you might want to kind of stay away from added sugars if you can. But then this is where it gets even trickier. People say, well, then I'm not going to have fruits because fruits are sweet. And fructose is turned into glucose in the body. Again, this is the slippery slope where people who are not biochemists, who are not research scientists, get into that realm where they can talk about the topic and make themselves more confused. I will tell you that although there is natural fruit sugars in a piece of fruit, the reality is when you eat a piece of fruit, an apple, a pear, a peach, something sweet, a grape, you are getting a lot more than the fructose in your body. You are getting fiber. You are getting polyphenols. You're getting all these other micronutrients, many of which can actually fight the cancer itself. And so food as medicine isn't a pill where you got good guys and bad guys and cyanide pills and cure-alls and magic bullets. Food is really a complex mix. And what we're really finding when you look at the evidence, again, evidence being really important, is that by and large, plant-based foods, even ones that have some natural sugars in them, actually help reduce the risk of cancer.
Snack number 1 is the humble apple, with a smart bonus from apple cider vinegar. Apples look simple, but they can do a lot for an older body. When people skip fruit and grab chips, candy, or ultra-processed snacks day after day, they miss fiber that feeds good gut bugs, and they add more sugar and chemicals that raise inflammation. Over time, that can lead to more oxidative stress in the colon and more tiny hits to DNA. Damaged DNA that is not repaired can push cells to grow the wrong way. In the colon, that can turn into polyps and later, cancer. Choosing an apple instead helps flip that story in your favor. Apples are a simple snack that can do a lot for your body, especially as you get older. When people skip fruit and eat chips or candy instead, they miss out on fiber that helps good gut bacteria and end up eating more sugar and chemicals that can cause inflammation. Over time, this can lead to more stress in the colon and damage to DNA, which can turn into polyps or even cancer. Choosing an apple instead can help protect your health. According to a study in the Reviews on Environmental Health, people who ate at least one apple a day had a lower risk of getting colorectal cancer than those who rarely ate apples. The study found that eating more than one apple a day could cut the risk by about half. The researchers believe this is because apples are full of special plant chemicals called polyphenols, which can help stop cancer from starting and growing. If you have had colon polyps, swapping a junk food snack for a washed apple with the peel can help your gut and may protect your DNA. The fiber in apples feeds good bacteria, which help keep your gut calm and healthy. For apple cider vinegar, which is made from fermented apples, some research shows it can help with weight and blood sugar control, but always mix it with water and talk to your doctor if you have health problems. Now, about apple cider vinegar. Dr. Lee often talks about metabolic health, because extra body fat and poor insulin control are tied to higher cancer risk. Apple cider vinegar, ACV, is made by fermenting apples and contains acetic acid. In a 12-week trial from Aichi, Japan, adults who drank a daily vinegar drink lost more weight and inches from the waist and lowered blood triglycerides compared with those who did not take vinegar. Other research suggests acetic acid can improve insulin sensitivity and may reduce fat storage. Better weight and insulin control mean less chronic inflammation and fewer grow signals that can feed tumors. Using apples and ACV is easy and safe when you do it right. Aim for one medium apple a day. Wash it well and keep the peel on because many antioxidants live there. Avoid eating lots of seeds. Good snack ideas include apple slices with a small handful of unsalted nuts, diced apple on plain yogurt, or chopped apple mixed into oatmeal. For ACV, protect your teeth and throat. Do not drink it straight. Mix 1–2 teaspoons in a large glass of water and have it with meals, or whisk it into a salad dressing with extra virgin olive oil. If you have stomach ulcers, severe reflux, kidney disease, or take medicines that affect potassium, talk with your doctor first. In short, apples help lower oxidative stress and may protect DNA, while ACV can support weight and insulin control. Together, they fit the food as medicine idea. Simple, daily choices that make your body less friendly to cancer. In just a moment, you'll hear about a plant protein snack many people fear, but strong research suggests it may protect DNA and even lower prostate cancer risk. Snack number 2, whole soy snacks, edamame and roasted soybeans.
Genistein, the phytoestrogen in soy, actually can also cut off the blood supply feeding breast cancer. So it's just the opposite of the urban legend out there that soy is not good for you. I recently saw an article. It was a cover of a magazine that said, soy anti-nutrients or something like that. And my mind was blown that somebody could actually say that, because most of the nutrients, including the proteins, but also the phytoestrogens in soy, again, if you're a scientist, you take a look at this, and the phytoestrogens look nothing like human estrogens. They're not dangerous. They actually block human estrogens, and they actually are also anti-angiogenic, and they cut off the blood supply to breast cancers. And this has been shown in human patients, breast cancer patients as well.
Whole soy snacks like edamame and roasted soybeans are sometimes called the plant protein that may help repair DNA and calm hormone-driven cancers. Many people worry that eating soy could feed cancers like breast or prostate cancer because soy contains plant estrogens. But research shows a different story. According to a review in the journal Antioxidants, soybeans have special compounds called isoflavones, such as genistein and dietary, that are much weaker than human estrogen. These plant isoflavones can actually block stronger estrogen from attaching to cells, which may help protect against certain cancers. The study explains that genistein, one of the main isoflavones in soy, can slow the growth of cancer cells, help repair DNA, and act as an antioxidant to protect cells from damage. Eating whole soy foods like edamame or roasted soybeans gives you these helpful plant chemicals, plus protein and fiber, without the extra fat and chemicals found in processed meats. For most people, enjoying 1 to 2 servings of whole soy snacks a day is safe and may even lower the risk of some cancers. If you have a hormone-sensitive cancer, it's always best to talk to your doctor or dietitian about what's right for you. To get these benefits, it matters how you snack on soy. When Dr. Lee talks about soy, he focuses on traditional, minimally processed soy foods, not fake meats. Better soy choices include edamame, which are young green soybeans usually steamed or boiled, roasted soybeans, often called soy nuts, firm tofu cubes, baked or air-fried, and tempeh, a fermented soy cake. Less ideal soy choices include highly processed soy meat products with many additives and soy snacks fried in low-quality oils with lots of salt. Practical snack ideas include a steamed edamame bowl with 1 2-cup cooked edamame sprinkled with a pinch of sea salt and maybe chili flakes, a crunchy soy nut mix made from 1 4-cup roasted soybeans mixed with a small handful of pumpkin seeds and a few raisins, and tofu snack cubes made by baking firm tofu cubes with a light coat of extra virgin olive oil, garlic, and herbs, then eating them warm or cold as a high-protein snack. As a portion guide, it is reasonable to aim for 1 to 2 servings of soy per day if your medical team agrees, with 1 to 2-cup cooked edamame counting as 1 serving and 1 to 4-cup roasted soy nuts also counting as 1 serving. Safety and special cases are crucial to mention. Large studies of women with breast cancer generally show that moderate soy intake is safe and may even be associated with better survival and lower recurrence, especially when eaten as part of a healthy diet. Still, because hormone-sensitive cancers can be complex, patients should always ask their oncologist and a registered dietitian about soy, and people on certain hormone therapies should get personal guidance. Coming up next is a red, juicy snack that can act like an internal sunscreen for your DNA and may help starve tumors by cutting off new blood vessels. Snack number 3, tomatoes, fresh and cooked.
Tomatoes have lycopene. So many of the same foods that we know are good, healthy, plant-based sources of nutrition, we're now rediscovering that many of the bioactives in them are also powerful cancer blood vessel cutting off systems that cut off that starve a tumor.
Tomatoes, whether fresh or cooked, are a powerful snack for protecting your DNA and supporting healthy hormones. The key nutrient in tomatoes is lycopene, which gives them their bright red color. Lycopene is a strong antioxidant that helps shield your cells from damage and lowers inflammation. According to a large review in Frontiers in Nutrition, people who eat more tomatoes and have higher levels of lycopene in their blood have a lower risk of getting cancer and are less likely to die from cancer. The review found that high lycopene intake was linked to a 5% lower risk of getting cancer and an 11% lower risk for those with high blood lycopene levels. It also showed that eating more tomatoes and lycopene-rich foods can help protect against prostate cancer and lower cancer deaths. Cooking tomatoes, like in sauces or soups, makes lycopene easier for your body to use, so both fresh and cooked tomatoes are great choices. Try to include tomato-rich snacks or sides several times a week to get these benefits. Swapping out processed, high-fat snacks for tomatoes can help protect your DNA and support your health as you age. If a man with a family history of prostate cancer eats pizza with very little real tomato but lots of processed meat and cheese, he gets the worst parts of the meal. Swapping to a dish that uses rich tomato sauce, olive oil, and vegetables while cutting back on processed meat may help shift the balance toward DNA protection instead of harm. One surprising fact is that cooked tomato snacks are especially powerful. Here is something surprising. Cooking tomatoes can increase the amount of lycopene your body actually absorbs. A Cornell University study found that heating tomatoes increased their trans lycopene content by 164%, depending on cooking time. Tomato products like tomato paste, sauce, and soup often deliver more bioavailable lycopene than raw tomatoes. Adding extra virgin olive oil while cooking helps lycopene dissolve in fat, making it even easier for the gut to absorb. This is exactly the kind of trick Dr. Gaz R. Lee loves. Use traditional cooking methods, like a simple tomato sauce with olive oil, to unlock more of a food's cancer-fighting potential. Snack ideas with tomatoes are simple and flexible. One idea is cherry tomato lycopene bombs. Keep a bowl of cherry or grape tomatoes washed and ready, snack on 10-15 at a time, or roast them with a light drizzle of olive oil and garlic until they blister for extra power. Another idea is a warm tomato olive oil dip. Gently simmer crushed canned tomatoes. Look for BPA-free cans and low sodium. Add garlic, oregano, and a tablespoon of olive oil, and use this as a dip for sliced cucumbers, carrots, or whole grain crackers. A third option is tomato soup as a snack. choose or cook a simple tomato soup that is low in sugar and low in cream. And enjoy a small cup as an afternoon snack instead of chips or cookies. As for how often, it is wise to try to include a tomato-rich snack or side at least several times a week. Next, you'll discover a simple green drink that can help repair DNA radicals, support immune cells, and cut off tiny blood vessels that tumors need to grow. Snack number 4. Green tea, hot, iced, or even frozen pops.
Way back when I got in this field, we had a test system where we were testing cancer drugs that could starve a cancer by cutting off its blood supply. And one of the things that I did is I actually dropped some green tea in there, and it was shocking how effective the green tea polyphenols were in stopping those blood vessels that were feeding the cancer. And in fact, if I didn't tell the technician doing the lab work that it was actually a natural compound, and I told them it came from a drug company, they would have been super excited about it and started jumping up and down. And so again, Mother Nature is really, really good. So polyphenols in tea, e.g. CG is one of them. Resveratrol in red wine, also another one that's actually really, really powerful in terms of being anti-androgenic.
Green tea, whether hot, iced, or even as frozen pops, is a calming drink that can help protect your DNA and slow down the growth of blood vessels that feed tumors. The main power in green tea comes from catechins, especially EGCG, epigallocatechin-3 gallate, which are strong plant antioxidants. According to the journal Biochemical Pharmacology, EGCG acts as a powerful antioxidant, helping to prevent damage to healthy cells, and also works as an anti-angiogenic and anti-tumor agent. This means it can help stop new blood vessels from growing to feed tumors, and can slow down cancer cell growth. The article explains that EGCG can protect DNA from damage, reduce inflammation, and even help the body's immune system fight off abnormal cells. Drinking green tea regularly, instead of sugary sodas or energy drinks, is a simple way to support your body's natural defenses and may help lower your risk of cancer. For most people, enjoying 2 to 4 cups of green tea a day is safe. But if you have health concerns or take certain medicines, it's always smart to check with your doctor first. To drink green tea safely and effectively, a few basics help. For brewing, use hot but not boiling water, because boiling water can damage catechins and also burn the esophagus, which may increase cancer risk over time if done repeatedly. Steep for about 3 to 5 minutes and let it cool a bit before sipping. As for how much per day, many studies look at 2 to 4 cups per day. Dr. Lee often suggests drinking green tea daily as part of a healthy pattern, not just once in a while. Smart green tea snack ideas include a warm cup plus fruit, such as 1 cup of green tea with a sliced apple or a handful of pomegranate seeds. You can also make iced green tea by brewing a stronger batch, cooling it, and keeping a pitcher in the fridge. Avoid adding sugar and use lemon slices or a few crushed berries instead. Green tea popsicles are another option. Brew green tea, cool it, mix with a little mashed fruit, pour into molds, and freeze. These can be great for sore mouths during some treatments if your care team agrees. Safety notes are important. Green tea contains caffeine, though usually less than coffee, so people with heart rhythm problems, severe anxiety, or sleep issues should ask their doctor how much caffeine is safe. Large doses of green tea extract supplements, not tea, have been linked to rare cases of liver injury. The whole beverage is generally considered safer, but anyone with liver disease must talk with their doctor. Green tea can interact with some drugs. For example, very high EGCG may interact with certain chemotherapy agents, so it is important to always bring up any plan for herbal drinks or supplements with the oncology team. The final snack might be the most dramatic of all. It's a sweet, ruby red seed that can help inhibit DNA damage, feed friendly gut bacteria, and has even been shown in men with prostate cancer to slow the rise of PSA. Snack number 5, pomegranate seeds.
So pomegranate, cranberry, Concord grape, the juices, you only need 8 ounces of a glass of cranberry juice, pomegranate juice, and you'll be able to actually grow back the Saccharomyces. I had a cancer patient, by the way. This was a couple of years ago, who had multiple myeloma, was going to get an immunotherapy, and her doctor was really gung-ho to get her immunotherapy, her oncologist. And her kids had a cold, so she had got a bronchitis and got a Z-Pak. Okay. And so before we started this immunotherapy, I basically said, let's check your stool. Sent out her stool for akkermansia, 0, which
Wow.
you would expect from the Z-Pak, okay, and the antibiotic. And I said, no, let's put the brakes on here. So we skidded to a halt before actually giving her the immunotherapy. I'm like, we do not want to waste this shot on goal. Like, this is her shot. And so I gave her cranberry juice and pomegranate juice. And we had her drink for 3 weeks straight every single day. And then we tested at the end of 3 weeks. So we delayed her treatment for 3 weeks. When we tested her stool again, she had 6 times above the average population of akkermansia. So she really killed it and got a ton of akkermansia. She got on her immunotherapy, and within 3 treatments, she responded to the upper 1% of responders. So she was like super responder and just completely recovered from her cancer, like completely wiped it out. And again, this is sort of me learning from research that had been done and published in the research and evidence, thinking about how food fits into it and actually using our body's own defenses to really help itself. This was not food versus medicine. This was food and medicine. And I think that's something I want your viewers to really take away from. Like, we're really not talking about food versus medicine. Like, we're way beyond that. Honestly, you can still have that battle, but it really is about this totality. We want to be able to figure out how to use all the tools in our disposal to be able to win this battle, which is called our life as we journey through it. And if we can enjoy ourselves with food along the way, that's really having our cake and eat it too.
Pomegranate seeds, also called arils, are sometimes called little rubies because they are packed with powerful plant compounds that help protect your DNA and may slow down tumor growth. When people skip fresh fruit and reach for cookies or candy, they miss out on these benefits. According to a study in the journal Nutrients, pomegranate juice concentrate is rich in polyphenols that show strong antioxidant activity, helping to stop oxidative damage to DNA. The study found that pomegranate juice could block DNA damage and reduce the growth of cancer cells in the lab, including colon, breast, and liver cancer cells. These effects are linked to the special polyphenols in pomegranate, which also help lower inflammation and support the body's natural defenses. Swapping a sugary snack for a handful of pomegranate seeds is a simple way to give your body more protection and support your health, especially if you are concerned about cancer. You've now seen 5 snacks that do far more than fill your stomach. They protect your DNA, calm inflammation, feed your gut, and even help weaken the tiny blood vessels that tumors try to build. Each snack uses a different part of your body's defense system, which is exactly the kind of
5%,
multi-point
38%.
strategy Dr. Lee teaches. Now it's time to lock these habits in so your snacks work for you every single day. Here are 8 rapid-fire micro-tactics to help you squeeze every ounce of cancer-fighting power out of these foods. First, use the peel power rule with apples. Always eat the peel because most of the quercetin and antioxidants live there. Second, follow the boil to protect method for whole soy foods. Steam edamame for 4 to 5 minutes and lightly roast soy nuts at low heat so you avoid burning the oils. Third, use the tomato oil trick. Pair tomatoes with a spoon of olive oil to unlock more lycopene and help your body absorb it better. Fourth, make green tea safer by using the 60-second cool down. Let the tea cool just 1 minute before sipping to protect your throat and preserve catechins. Fifth, use the Berry Boost combo by adding pomegranate seeds to yogurt, smoothies, or oatmeal to raise antioxidant levels at breakfast. Sixth, practice the color every snack rule, meaning every snack should have at least one colorful plant: red, green, purple, or orange. Seventh, keep the no-burn zone whenever you cook plant foods. Avoid dark browning, which can create unwanted compounds. And eighth, use the 2-snack anchor. Choose 2 protective snacks, like apples and green tea or pomegranate and soy, every single day so your defenses stay active. Now for a quick set of answers to the questions older adults ask most. Can soy feed cancer? No. Whole soy foods like edamame and tofu are safe for most people, and may even help protect DNA. Are apples too sugary? No. Apples contain fiber and polyphenols that slow sugar absorption and protect your gut. Is tomato sauce better than raw tomatoes? Often yes. Cooking helps your body absorb more lycopene, especially with olive oil. How much green tea is safe? Most older adults do well with 1 to 3 cups per day. But always ask your care team if you are on special medications. Can pomegranate juice replace the seeds? It can, but keep portions small because juice has more natural sugar. Whole seeds are best when you can chew them. Picture yourself at your next checkup. You've replaced sugary snacks with apples and pomegranate. You've swapped processed protein bars for edamame or roasted soybeans. You've added cooked tomato and green tea to your day. Your body is calmer, your gut is stronger, and your daily habits now help protect your DNA instead of harming it. This is how small changes become real power. If you enjoyed this video, make sure you subscribe and turn on all notifications so you don't miss our upcoming videos.